Hello everyone, it's Dr. Rafael Gutierrez, the Karate Doctor, and one of the things I'm going to mention today is a little bit about me, but the topic I'm going to talk about, like I said, is ADHD and martial arts. Now, when I'm actually where I'm coming from is this: I do have an MD, I also have a bachelor's in biology, and I've been teaching anatomy, physiology, microbiology, clinical anatomy, clinical micro, uh, pretty much a lot of different classes, and a lot of times when I come out with a topic, I do research it. I go to PubMed, I go to, in this case, the DSM-5, and I go to experts to see what they're saying. I also go to people who have the certain issues and see what they're saying. In ADHD, I went online and I tried to find a lot of people who were talking about their experience with ADHD. Now, sometimes you'll hear me say, when I answer a question, I must have missed that. Sorry, it could have been my ADHD. I do have ADHD. And when people hear that, a lot of times they wonder how I was able to get an MD and a bachelor's in biology with ADHD. And one thing I will tell you is ADHD has nothing to do with the level of your academic possibility. What ADHD is it's a separation between what you actually know and what you achieve. What I mean by that is this: someone with ADHD can have all the knowledge in the world, but their achievement for some reason doesn't reach that level. I'll say that a different way. Pretty much imagine someone with ADHD. This is the problem with someone with ADHD. They have the knowledge, but what they show isn't at the level of where their knowledge is. That's where the difficult thing is. So you have someone who may be great at math, but their level, where they're showing you their math skills are, is a lot lower than where their math skills usually are. Their math skills really are. It's not a thing of laziness. It's just a thing of, it's actually a biological aspect, which I'll talk later. Now, the first criteria that I actually tell people when you're looking at ADHD is what the criteria are. Now, a lot of people say ADHD, oh, someone's distracted, they have ADHD. Truth is, there's a book called the DSM-5. DSM-5 is what psychiatrists and psychologists use to determine if someone has ADHD. If you think you have ADHD or if you think you have a child with ADHD, have them go to a psychiatrist and psychologist who specialize in ADHD so they can evaluate, because it will help them out a lot. Now, what the DSM-5 says is there's actually 3 different types of ADHD. And for a diagnosis of ADHD, you should not be able to explain those symptoms based on another disorder they have. So if they have another disorder and those symptoms actually explain ADHD, their symptoms in ADHD, they shouldn't be both. Now, again, it needs a qualified psychiatric or psychological practitioner to actually determine what it is. So we have for ADHD, there's actually one of 2 criteria, either inattention or hyperactivity or both. I'm actually one of the people who technically falls into the both, but there's different criteria. Like I said, one of them has to do with hyperactivity. So, for instance, can you sit still for a long period of time? Anyone who knows me knows that if you put me in a chair, you may as well stab me, because any longer than half an hour and my feet start bouncing, my hand starts moving, I start fidgeting with my hands just like I'm doing right now, right? And so that's actually one of the hard things. By the way, I found out that's actually what makes me a great professor. And I hate to call my own self a great professor, but that's what my students have actually usually told me. I don't stand in one podium and just stand here and say, oh, well, listen to me. Usually I'm walking, I'm writing on one side, I'm pointing out this guy on this side, I'm trying to put things together, and a lot of students seem to enjoy that. I will actually mention when I do teach anatomy, for instance, my pass rate and grades tend to be a lot higher than my colleagues, and I've actually shown some of my colleagues my exams, and they actually didn't score, they scored at a B level, and my students are actually scoring a lot higher. I've actually gotten peer reviews telling me that my classes are far too advanced for my students, yet my students are actually, my pass rates for anatomy is somewhere in the 80 or 90%, and usually most people do a B or better. So something's going on there, right? I also, by the way, make all my tests fresh, so it's impossible for cheating to go on too well. And I am pacing and looking and making sure everyone is not cheating, by the way. I do a lot of different things. So I do have that one thing where I've noticed that ADHD for teaching is something really good for me. Now, there's actually a couple different other things now, and the reason I'm mentioning I'm going to put in martial arts with this is so you can see what I'm talking about. For instance, the whole idea of martial arts is to actually watch different things happening at the same time. ADHD, this is actually something great because you are looking for signs of something different. For instance, if you see someone doing a test and they're doing this every so often, you know that they have something there. I have caught a lot of people cheating, thrown them out of the class. Those are usually the people who were actually they would have failed in the class, but they didn't because they got kicked out for cheating. So that hyperactivity, always looking for the other stimuli helps when I'm actually giving tests. In karate, we actually use that. If you think about it, if you're doing any sparring, you're actually looking at different movements and trying to have the person react to that. So ADHD actually does benefit a lot from martial arts because they're able to learn to focus on multiple things at the same time. And that's one of the things that a lot of articles on martial arts for ADHD have found. Now, there is also another one, which is a distractibility, where people actually misplace stuff. Now, I do have a little bit of that, and so I've actually found ways to compensate, and one of the ways I do is I'm always early for anything. I actually make sure that I put alarms for everything, and I make sure that if I have to be somewhere at, let's say, 8 a.m. in the morning, I'm going to be there at 7:30, so I have everything ready just in case I forgot something. On top of that, I actually am usually able to get by with, if I do forget something, I have the knowledge to understand where, okay, well, I forgot this, but I can actually draw these pictures. By the way, has been it's been really beneficial. One of the cases that happened, that I went to a classroom, I had my lectures ready, all the pictures from my lecture, never put my lectures, just my pictures, on a thumb drive. I went to the computer, and the computer had blown up. It had stopped working. And so what I ended up having to do is, I drew all the pictures from rote memorization. Making it real easy for anatomy. And you should have seen the notes that people had because they were beautiful. So the thing with ADHD is it's not going to necessarily inhibit what you can do. But you do have to learn to adapt to having ADHD. Now, the other thing that, besides the DSM-4, the other thing that I actually did look at is I looked at what the biological cause of ADHD was. Today, we have so many great scientists that we can find the information of not everything, obviously, but things are coming out so fast that if you're not careful, you get left behind. And with ADHD research, there's been a lot of people who have found that one of the reasons people have ADHD has to deal with an increased metabolic rate of the dopamine. Dopamine is a neurotransmitter. It's a message that gets sent to your brain, and it tends to cause certain things if it gets too high. In ADHD, you will not have it too high, but just to give you an idea. With neurons, by the way, anything's too high, it's bad. Anything too low, it's bad. If you actually take too much dopamine, you tend to have schizophrenia. You can have the auditory hallucinations, visual hallucinations, a lot of different issues that are considered pathological. ADHD would have the opposite sometimes, where there is actually pretty much the worst part of having low dopamine levels would be something like Parkinson's, where you have the twitching and movements, which makes sense if you think about like what I told you about ADHD. If I'm sitting, you'll see me twitch, you'll see me move. And that doesn't have to do with Parkinson's, it has to do with the dopamine receptors. The dopamine being broken down quicker, which is how the medication for ADHD seems to work. Now, with ADHD, it's broken down quicker, and so a lot of times, especially when people are young, they have issues with how they move. I'm going to use myself as an example. Up until I became, I'd say, 18, I was the clumsy kid. I was the guy who was chosen last whenever we were in PE. And the reason had to do with nobody wants to lose. And so if you had me on your team, well, I wouldn't necessarily be able to move as much. And if I got distracted and we were playing, say, baseball, the ball may actually land right in front of me and I may have missed it, even if I could have caught it. Now, if you think about this, if you have someone with ADHD, they may benefit a lot from sport activity physically, but mentally, you're going to have a guy who's going to be blamed for a lot of the issues that happen when they're playing, especially as people want to win. Now, why martial arts are actually important. If you actually look at a lot of traditional martial arts, and actually a lot of martial arts, we deal with technique. It's not, a lot of times you're not necessarily competing against someone. For instance, when you're sparring, it doesn't matter if you make the point. You actually, what you want to do is you want to get the technique right. You want to make sure that things are done a certain way. And so with traditional martial arts, when you're actually doing something, let's say bringing back here, having your hand go from here to here becomes a big accomplishment when your muscles, your neurons don't let you turn. Once you're actually able to do this, well, now you have the accomplishment and you've actually made a pathway that helps you move a little better. Right? One of the reasons why traditional martial arts may be more beneficial to ADHD than other things. Why also yoga and dance would be beneficial. You're not dealing with, are you the best yoga person in the world? Are you the best dancer? Unless you're doing competitive dance. In martial arts, again, yes, you can do competitive, but there's also that thing about just learning to do stuff. And so that is one of the big things that does help, is that movement. So, my life in karate, actually, my life with ADHD really has been something that has been with me my entire life and continues to be with me. I do have an issue with, actually, I do have a small issue with impulse control, especially when I feel someone is wrong. I tend to try to pull myself out. But, for instance, one of the things that happened one time is I was given a poor evaluation and by a peer. Now, I actually took the peer's evaluations, and I took my class evaluations, my class grades, and the information I had, and I wrote a rebuttal which had references showing why this person was wasn't capable of evaluating me. One of the things I said is she said she was confused in the class, yet all my students were saying that the class was the most fun, interesting, and easiest to follow. I showed the grades of my class, which were A's and B's mostly, and I actually ended up showing research that had shown that the way I do stuff was more likely to get higher results based on education and neuro than what the person was suggesting. Now that kind of irritated a supervisor, but the other one said it was okay. Well, I was right, and actually said he never had something so well researched before for a commenting about a bad evaluation. So that's actually one of the issues with ADHD that I've had to deal with. The benefits that I have noticed, so like I said, is most people actually enjoy my ADHD when I lecture. Why, I don't know. A lot of times I actually wonder, it's like, well, look, wouldn't it be better if I did X, Y, Z? And I'm always trying to make it better. And that might be part of the ADHD. So, one of the big things that I will come out with in conclusion is this. There's a lot of different things that are ADHD. There's a lot of things that are not. ADHD is a lifelong condition, although they do say 1 in 6 people will outgrow it. And I probably is someone who has relatively mild ADHD. The other one is there is a component with emotion, there's a component with maturity, and there's a component that's physical. All 3 of these actually are something that, with karate training, someone with ADHD would be able to benefit. And last, if you have ADHD, or if you have a child who has ADHD, that does not mean that they are limited to what they can pursue. They can pursue anything they like. Just make sure it's something they're really interested in. I hope you enjoy this and have a nice day.